Hey, y'all, it's Michelle with SLP Full Disclosure, and welcome to the podcast today. We have a really exciting show. We are joined by I'm going to call her my friend. We've met once, Regina Ramone from Cabo San Lucas, Mexico. Regina, thank you so much for joining us today.
Oh, thank you so much for having me.
Yes, we're going to be talking about a couple of different things. So, I vacation in Cabo every summer. I love it. And I don't even know what made me start searching for speech pathologists in Cabo last year before we went, but I started searching and came across some information about, their training and how services are provided. I couldn't really find anything about school speech language pathology. So, I just reached out to Regina and she very kindly responded to my email, and we ended up meeting and having lunch while my daughter and I were there, and it was wonderful to talk to her. Um, Regina is a speech language pathologist and she specializes in cleft lip and cleft palate right now. And we're also going to be talking about that and just the specific therapy techniques because it is a little different than your traditional articulation therapy. But we're also going to be talking about how services are provided in other countries because I was under the misapprehension that because I live in the United States and I have my master's degree and I'm trained and ASHA certified, I have my C's, the continuing education, and that children here have access to services starting at birth with early intervention, that that was this case everywhere. And unfortunately, it is not. So, Regina is going to give us some insight on how the services are different in other countries, specifically in the area where she lives in Cabo San Lucas. So, Regina, I'm so excited to have you here. We've been trying to get this scheduled for quite some time.
I know.
I know. All right. So, let me tell you guys a little bit about Regina. She has an amazing, amazing bio here. She is a speech language pathologist who grew up in a border town in Del Rio, Texas, where two cultures shaped her love for language and communication. She earned both her undergraduate and graduate degrees at the University of Texas at Austin, where her master's studies focused on serving bilingual populations. After graduation, she began her career in early childhood intervention, supporting children and their families during the most critical stages of development. Later, she transitioned into a medical setting, working in a nursing home and rehabilitation center, where she gained experience in the medical aspects of speech therapy. During that time, she continued to supervise a speech language pathology assistant at early childhood intervention, combining clinical and educational perspectives in her work. A few years ago, her family moved to Los Cabos, Mexico, where her husband, a dentist, opened a dental clinic. Soon after, they were approached by two local foundations, Cabo and Los Cabos Children's Foundation, to collaborate in providing care for children with cleft lip and palate. Through that collaboration, she discovered the speech therapy side of the program and was invited to become the director of Cabo, a role she's proudly held for the past 6 months. Wow, I'm so excited to have you here and pick your brain. The first thing I want to talk about is you've got such a diverse background and you've got so much experience in different settings. I too love early intervention. That birth to three population is just my heart. But did you go into your current job with Cabo having that specialized training in cleft lip and cleft palate?
No, I actually really had no experience with cleft lip and palate. And I mean, I remember, I think from my master's program and doing different rotations in hospitals or something, in different clinics, seeing a little bit about cleft lip and palate, but I never specialized in it. I really didn't know too much about it. I knew the overall, just kind of like the general what you would typically see in kids with cleft lip and
Hmm.
palate just because of my educational background, but I really didn't have any clinical experience whatsoever. So that was really interesting when I started this job because it was a whole different side of speech therapy that I really hadn't explored.
Right. And that's just another great example of how the field of speech pathology is so diverse. We
Super
had a
diverse.
guest on earlier today that we recorded talking about fluency, and that is just it's a very small niche of what we do. And I think the cleft lip and cleft palate is the same thing. It's an area of specialty,
Right.
and obviously those therapy techniques and how you approach it are very different than a traditional articulation student. So let's talk about that. How does that therapy differ with cleft lip and cleft palate as compared to just traditional, let's work on an R, an L, or an S?
Yeah, so just with traditional articulation, it's more functional that, with these errors that we're seeing, it's due to, like, function and how they're not maybe doing the correct placement of articulation, but it doesn't mean that they can't do it. With cleft lip and palate, it's more structural. So
Right.
there's something going on, with their anatomical structure that's not
Mhm.
allowing them to produce certain sounds. So we do see a lot of compensatory errors because of this, because they really physically cannot produce these sounds. So
Right.
um, it's a lot of therapy, and it's even before they have any of the surgeries. You start working on placement of articulation even begin before they have the surgeries in order to start, to get them kind of thinking about that. How should I be producing this sound? What is a typical production of this sound? Where is the placement of articulation? So we work a lot on this with these kids, and then once their surgery is completed, then they have the placement of articulation. So it's
Yeah.
just kind of an easier transition for them to be able to produce these sounds.
Right. So at what point are you getting them to work with them? So you said that you start with some of those articulation placement strategies before the surgery. At what is the kind of what's the process? So a child's born with cleft lip and cleft palate, and at when do they have their first surgery, and how many surgeries are you looking at after that?
Yeah. So the first surgery is always the lip, and that usually happens. So something that I want to also say is I work with a foundation here. So I work with
Mhm.
Cabo. So we don't typically see these ideal situations.
Mhm.
So ideally, when the child is around 3 months of age, we have the first surgery, the lip surgery. But in order to have that surgery, they need to it's like the rule of 10 is what they call it. So they at least have to be the 10 weeks old, 10 pounds, and the 10 of hemoglobin. And this is all for the baby has to be healthy enough to be able to have the
Mhm.
surgery. And also for them to be able to recuperate from the surgery properly.
Mhm.
And the
Yeah.
healing process has to be, there's a whole so the child has to be healthy enough, and sometimes we don't see that here, and it's tough. And then the second surgery would be around 9 to 12 months of age. And then we start working on speech. We get these kiddos ideally when they're born, and we work
Mhm.
with the families kinda like early childhood intervention, and we start
Yeah.
working on babbling. And sometimes what happens a lot is these families don't because the child isn't producing a lot of sounds because they can't, and we
Right.
don't see the typical babbling, parents won't, you know, play with them like they would a typical developing child
Mhm.
because they do hear it from them. So it's kind of
Yeah.
like answering back and forth, and so we work on babbling on sounds that they can produce. So we'll work on babbling with nasal
Mhm.
sounds. And so we start working with the families from very early on and kind of teaching the parents. I think what's really, really important,
Mhm.
especially with our population, is for the parents to understand what and why we're doing what we're doing.
Right, so that
Uh,
they can support that at home because
exactly.
they're at home the majority of the time, so that it's
Exactly.
kind of like that early intervention piece, but early intervention doesn't really exist in Mexico, correct?
Correct. No, it
So the
doesn't.
only children that are getting the services from a speech pathologist are those kids that have cleft lip and cleft palate.
Yeah. I mean, it's what we do see a lot here is we don't get that in Mexico. We don't get that immediate follow-up like we do in the States.
Mhm,
In the States, you have a baby, they're born with a cleft lip and palate, and your journey begins right there. You start seeing
right,
specialists, pediatrician, they'll do referrals, you're referred out to ECI or early childhood intervention. Um, and you're just kind of going along this whole process with somebody kind of holding your hand through it and telling
and
you, what's
what to do
next.
next. Yeah,
Yeah. And here, there there is none of that. So really, speech therapy and a lot of other therapies are seen mainly in with families that can afford to pay private pay because they're mainly in private clinics, and also that they have the ability to find out, what it is that you have to do. Especially our patients and our families. I mean, they really don't even know where to start. So, it's really hard to start this whole process with them and for them to really understand. And then there's a whole other cultural, there's a lot of cultural, things that we have to hurdles that we really have to go through because sometimes it's like, I don't know, my uncle was like that and he learned to speak on his own and he never got surgeries. And it's like, no, 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 no. Let's try to
Yeah.
change that.
Yeah.
But
Right.
so yeah, that's also been interesting.
So, with these kids, when you get them, how long are you typically working with them? Because they come to your foundation. The
Right.
foundation provides the speech language pathologist, and we're going to get
Mhm.
into that here in a little bit. So, we're not going to get into too much detail. But so they're coming to you. How long do you typically work with them? And are these kids like toddlers all the way up through 18, 21? Do you
Yeah.
see everybody?
We do have both kids and adults.
Okay.
But typically they're kids. They're young kids that have been with us for, I mean, it varies. We do have babies. We do get some babies, and then we kind of go through them throughout the whole process. We do
Hmm.
have a multidisciplinary team here. It's a comprehensive team where we have an orthodontist that they get all their dental work. They do speech therapy, the surgeries as well, audiology. We do see a lot of
Hmm.
hearing loss in kiddos with cleft lip and palate. So
Hmm.
we kind of are with them through a whole process. Sometimes they pause speech therapy for a while, but they continue in the program. And then we
Hmm.
pick them up again after their surgery. So, I
Okay.
mean, sometimes we see these kids we've had kids in the program for 5 years.
Hmm.
I
And
mean, and it can go on longer.
And Communicabo is the only foundation in Cabo San Lucas that provides the speech therapy for children with cleft lip and cleft palate. So they're not able to go to their local school district and have a speech pathologist support what you guys are doing outside of school, correct?
I mean, to be honest, I don't know if there are any private clinics that anybody that specializes in cleft lip and palate, but
Mhm,
yeah, I mean, this foundation started because in ENT, a doctor from the States was coming to operate and his wife was a speech therapist, and she was like, "Who is seeing these kids after?" For speech. So she started this program and it's been amazing. And, it came from she's done something really, really special here in Cabo.
What would you say, Regina, is the biggest misconception about speech therapy as it relates to infants and children with cleft lip and palate?
I think with our families, what we see a lot is they think it's a quick fix after their surgery
Mhm,
is done. It's
mhm,
like they think that they had their palate repaired and then we should be able to see them for a little bit and then they should be on their way. And it's not always like that. It's a whole process. It's a whole thing. Also, it's so important the post like surgery care. We don't see a lot of that sometimes. So we do see fistulas. We do see the palate open up again. It's really frustrating for the families, but it just takes so much from the entire team to be able
mhm.
to get these kids to where they want to be.
Right.
And I think that's difficult because they think, well, we're doing everything. We had the surgeries. Now what, now what? And
Now what?
yeah, and it's not
And
like
it
that.
also probably depends on the severity of the cleft palate,
Exactly.
because there are different severities of cleft palate. Some can be
Yeah.
small, some can be large, so I think
Some
a
are
lot of it
unilateral,
depends.
some are bilateral. Yeah.
Right. There's a lot to consider. When you're looking at those speech sounds, and we're talking about you mentioned earlier the anatomical structure, and we know that those, they're not, the velopharyngeal closure, that kind of stuff, you're gonna get the hypernasality.
Right.
I think speech pathologists know those common errors, which are those, those sounds that require more air support are gonna be
Right.
more difficult to produce.
Yeah.
At what point do you say, "Okay, we have to look at this at from the standpoint of this might be just speech sound differences versus this is a speech disorder due to cleft lip and cleft palate." Like, how do you measure that? How do you measure and say, "Okay, yes, you still may have some speech sound differences, but we've done all we can do
Right.
in
So
therapy."
when it comes to like insufficient velopharyngeal closure, it sometimes it's so this happens after a surgery is what we
Mhm.
can see, and it's impressive how people that have been in this field for a really long time, the cleft lip and palate speech therapists that have been there, and they have such a clinical ear for it, and they know
Mhm.
like, oh, this is, in, there's insufficiency here, and then the velopharyngeal closure. But it's
Mhm.
not always the case. Sometimes it takes you a while to figure it out,
Mhm.
because these kids have learned because they did have this air escaping through their nose for,
Mhm.
a long period of time, and that's how they learn how to produce these sounds,
Mhm.
that it you don't know sometimes if it's just they're continuing to do it that way because that's how they initially learn how to do it, or is there is the VLM not closing properly?
Right.
So there gets to a point where you have to, do they have the correct placement of articulation? You also see other sounds, have they're producing other sounds correctly. And then you send them off once you're like, I've done everything I can. I still hear the hypernasality. Then you can send them to get the nasendoscopy. And then that's when we can really determine if the velum is closing properly or not. But it takes a whole team. Sometimes, I mean, we work with the surgeons and we're like,
Mhm.
"Do you hear it? Like, do you listen to this? We've been working on this for, I don't know, we give them a time, and if we still see the nasality, then we refer them out to see if
Yeah.
they're with imaging, if we can see if it's closing properly or not. And they
Yeah.
might need another surgery
How
to
many
repair that.
surgeries typically does a child have to have? Does it just depend on the severity?
It depends on each child. But the
Yeah.
main ones are the closure of the lip really early on, and then closure of the palate. And then from then on, it's just depends on how successful the surgery is. And I say successful like this because it's I mean, what is a perfect success story? It
Yeah.
varies from, patient to patient, but it really depends on how everything is healing after surgery, and then how much, of work they do during therapy in order for
Mhm.
them to be able to reach their overall goals.
Yeah. So it's just
Yeah.
really it just depends. There's no way to know that this is the outcome when I see this type of cleft palate or, this severity
Yeah.
level. There's no way to say it's not a cookie cutter. Each
No.
child
And
is going to respond differently to those surgeries depending on how their body healed and depending on a lot of different factors, it sounds
yeah.
like.
And also, it's all about it's really interesting that sometimes I just went to a conference, not too long ago, and they were speaking so much about asking the patient, first thing, it's like, "What do you want?" Like, when it comes to mainly more like plastic surgery, type
Mhm.
surgeries after, and sometimes the surgeon can say, "You know what, your nose, you know, I recommend we do this or this to make your nose look better." I mean,
Mhm.
who are you to say that, your nose needs to look better? So
Right.
they're making a huge shift, and I don't know, maybe this has been going on for a long time, but especially in the States where it's like, what does the patient want?
Yeah.
Sometimes you can have so many surgeries to correct so many aspects of physically, but is everything functioning properly?
Right.
If it is, do they need it? Do
Right.
do they want it? And if they want it, of course they can get it. But if they don't want it, why even bring it up?
Right. Yeah, I know.
So
I
that
worked,
was a whole thing.
one of my first patients that I ever or clients that I ever had that had cleft lip and cleft palate was in Alabama, and the little girl was, 6 years old. She moved to Alabama to this district where I was working, and she had never had speech therapy. And the teacher, of course, they're like, "Oh, we have to refer for speech, her articulation, blah, blah, blah." We do the referral meeting, we bring the parent in, and the parent was like, "We understand everything she says. She's
Mhm.
not, you know, she's not concerned about how she sounds." And I guess at 6, you can say, "People are making fun of me or I sound different." I think that's probably we talked a little bit about that this morning about around the age of 7 is when kids start to see, "Oh, well, I am different and I look
Mhm.
different and I sound different." And the parents completely were like, "No, we don't want any speech therapy for her." And she was intelligible.
Mhm.
Everything she said was intelligible, but were there speech sound differences? Absolutely. But her parents were very much, "Hey, this is how God made her. This is how she sounds, and we're
Yeah.
not going to do any kind of speech therapy for her." She was smart. She was doing well in school. And just like you said, who are we to say, "Hey, that needs to be fixed"?
Yeah.
And the parents were very kind, and they were like, "Thanks, but no thanks. We're not gonna go
Yeah.
there."
Yeah,
And
and I
so
think, yeah, overall, the overall goal is for them to be intelligible and to be
mhm,
able to, be understood,
right.
and not have these compensatory errors because those make it really difficult
Mhm,
for intelligibility. I mean, you don't really understand really now that I've been in it and I've been able to hear it, I understand the child and I know what they're doing
mhm,
to if they're doing, like, a glottal stop instead of, like, a P, I know that they're doing it. So
mhm,
now I and it helps me because now I understand that. But if you have no background in this,
mhm,
it's really hard for you to understand what they're trying to say.
right. How is Communicabo how do you provide these services? Are they provided do you have a clinic? You have a brick and mortar building where they come for speech therapy, and how many speech therapists do you have?
So in Comunicado, which I wanna say that the founder, her name is Tanya Hetch, and I wanna just make sure I mention her because this has been, I think, such a, like, passion project for her, and she's done such an amazing job. So I just wanted to mention her name. But, um we have there's 2 like you mentioned at the beginning, Los Cabos Children's Foundation is a really big foundation here for kids in Cabo,
Mhm,
and then there's Comunicado. So we work together as part of a comprehensive Cleft and Palate program, and we actually have 6 speech therapists on our team, and we serve both, Cabo San Lucas,
mhm,
San Jose del Cabo, and La Paz.
okay,
So we help all the kids in Baja California Sur, but we have different therapists that serve different locations. So
okay,
we have offices in San Jose, which we work with another foundation that's called Inspire Mexico also, and they provided this building and they actually built us these offices. So they built
okay,
us 3 spaces within a really big building that specifically for our needs. So our speech therapists are there in San Jose, and then in San Lucas we have a small space where we provide speech therapy, and then in La Paz it's in one of the state hospitals. We
okay,
have spaces in there. So I
okay.
mean, we work a lot with different foundations for to get these spaces.
Because it's primarily private pay, right?
Everywhere else, yes.
Mhm, yeah.
Mhm. Yep.
Alright, so now let's talk about the speech therapy services and the speech therapists in Mexico, because this is what really blew me away. And you and I talked about this on the phone before I came and met you in Cabo,
Mhm.
and we talked about it at lunch. We've talked about it several different times, and it just blows me away because
Yeah.
when you say we're providing speech therapy services to
Mhm.
children and adults with cleft lip and cleft palate, I think we have a certified speech language pathologist that has gone to an undergraduate program, moved on to a master's program, received their master's degree, completed that clinical fellowship year with all those 100 and some odd hours under the
Yep.
supervision of a certified speech language pathologist. They've passed a praxis, they've done all this training, but that's not the case in Mexico.
No, it's not.
Okay.
No, so in Mexico, I think it's a fairly new well, no, I don't think. I know it's a fairly new profession. So I think it's picking up a lot more recently, but whenever
Mhm.
I was looking at different schools, there were no schools in Mexico really that or not no schools, but there were very, very few schools that had any speech therapy programs, but they were more kind of like part of a psychology department, part of communication, part of like but it wasn't part of maybe education, but it wasn't like a speech language pathology program like it is in the States, where it was
Right.
I applied to go to the speech language pathology program at UT.
And
And then
get
I
your
applied
master's
for
there.
the
Yeah.
exactly. So
Mhm.
it was a whole process and it was even like not shocking, but it was surprising to me that there wasn't really speech therapists in Mexico.
Mhm.
And and I guess when I say speech therapist, there were people providing some services, but they focus more on the educational part of it, more like the language part of it. They were having trouble with reading or things like that. A speech therapist would help with that here in Mexico.
Okay.
Um, but it's not one of our the speech therapists that works with us. She is in charge of in La Paz. She makes sure that the different schools have a speech therapist, but it's not. And I actually we had a meeting last night, and I told him about the podcast, and I was like, so what do you see in school? Like, what do you see? Because she is working in public schools, but she was like, the kids that we see in the school, it's not even like a speech therapy program. So she was like, don't think of it as like we're going in speech therapists pulling kids out
No
and we're having a
IEP,
one-on-one, no
no formal
IEPs,
documentation, no
some sort of
tracking of progress.
documentation, but I don't know exactly what that looks like. I don't think it's as extensive as it is in the school districts in the states, because I worked in the school district and it's a lot of paperwork.
Yeah.
And she was like, you now they're changing to they're focusing more on the social part of it. So now they're not pulling kids out of classrooms anymore. So she
Okay.
was just telling me this last night. And she was like, this is new. This is brand new this year. They're not allowing us to take kids out of classrooms anymore. And we have to sit with them during class. And I'm like, well, what do you do with them? Like for speech? Like, how do
Yeah.
you? And she was like, no, because you sit with them and you make sure that they're understanding the assignment and understanding that, they're the homework assignments, or I don't know. I
That's like educational support. That's not
exactly.
the child that can't do an R or an L or an
Right.
S or
So
has
they
a
don't do
language
any
delay.
of that, yeah, in schools.
Oh, wow.
And the kids that are specifically pulled for speech therapy services are kids that are very, very delayed. And there's something else going on. They probably have some sort of diagnosis. Maybe they're not diagnosed.
Mhm.
There's something else going on. So
What
they're the kids that are getting the support.
what about those kids who are born with Down syndrome or
Mhm.
cerebral palsy? What about those students in the school? What kind of support or children with autism?
Mhm.
How are they being supported?
You know what? I so in the private school, I mean, I can speak more about the private school because, to be honest, I don't really know what goes on in the public school system,
Mhm.
because I don't even know if they're allowed to go to school in the public school system. I don't know. I need to look into that more. But in the
Yeah.
private school system where I have my kids, and as you know, my daughter has autism, but it's a struggle. It's a
Mhm.
struggle. The teachers are not, I feel like, prepared. So my
Mhm.
daughter goes with a shadow that I
Mhm.
have to pay for. She's she's somebody that I had to get, and I worked really hard to get this person to help me out with my daughter, with the whole therapy team that I take her to privately.
Mhm.
Um and and it's a struggle. So I can't imagine what goes on in the public school system. Even the
Wow.
private school system, we don't have any speech therapists on campus. Um, there's really no, I mean, you kinda have to look for your own and pave your own way in the schools, and
And
it's
find your own
difficult.
support. Yeah.
Yeah, and find your own
And
support, and
it Cabo is a very wealthy area,
mhm,
and there is a lot of money there, but not
right.
everyone has access to that. So you
No,
and your husband have the financial ability to pay for that shadow and to pay for the
exactly.
private therapy, and not all families have access to that,
Right.
which I would think
Yeah.
just makes it even worse.
And I feel like it's not even that they don't have access to it financially, but I don't even think they think about it. I don't even know if they think that it is an option to do this. I
Yeah.
come with a whole, because I am a speech therapist and what I've done in my whole life, or not my whole life, my whole working life,
Right.
with these kiddos, I knew kind of where to start. I knew what doctors to
Mhm.
look for. I knew kind of where to go, but even moms that are in the private school system that have come up to me and are like, "What do I do? Where
Yeah.
can I go? Who can I see? Who can help me?" I mean, I there's a big need, I think, in Mexico in general to just I think also with pediatricians, kinda starting from there. Like, we
Yeah.
need referrals early on. We need to, get these kids in therapy, the earlier the better, and we do not see that here.
Is there a licensing process for speech pathologists?
No. No, and it was really funny because I think it was yeah, my state license had to be renewed, and I had to get some continuing education hours in, and I it was a whole thing because I'm in Mexico, so I had to go back to the States, and I was gonna be in California, and it was a whole thing, and I was telling the therapist then they were like, "What are you talking about?" And I'm like, I have a state license and I'm ASHA certified. Like there's 2 different things that I have to be updating
That you have to
every certain
maintain.
amount of time. Yeah, and maintain. And they're like, "That is crazy." Like there's nothing like that here. So you graduate from the program, the 2-year program, most of them are a 2-year program,
Mhm.
and then you're ready to go out, but they don't have a lot of the same like, we during our master's program, you see a little bit of everything. You see a little bit of the medical part of it. You see educational part of it.
So, it's typically a two-year program that they
Mhm.
graduate from, and
Right?
that's all they have to do. There's
And
no
then that's all they yeah, and they don't have all the experience or exposure that maybe we have in the States where you get, like, the clinical background, the medical background, the educational background, like, all of or the different settings, maybe
Mhm.
is a better word. They don't get that here. I mean, so it's really focused on more than anything, like, articulation and learning or yeah, I mean, not so specific like
Yeah,
we have in the States.
with our master's program.
Yeah.
Very in-depth. How many hours do you have to get that last year of graduate school? Like, all the different areas. You've gotta do adult language and then
I
child language and the artic and the fluency and the voice. You've gotta get all of those hours, and
yes.
they don't have that extensive training.
No. No, no, no. Not at
Okay.
all. When I first got here, they actually called me in to talk about dysarthria because they really had I mean, really no knowledge about it. So, we went in, we had this, a little just little
In
conference with,
service?
like, all in service, yeah, with
Mhm.
the speech therapist, and they were able to ask and they asked me a lot about different but, I mean, right now, they do see so many kids that it's so specific. I mean, only cleft lip and palate kiddos, so it's so specific that we really
Yeah,
don't see a lot of other things going on,
yeah.
other than language, but yeah.
Awesome. Alright, tell us about Communicabo. Tell us about the foundation. I want our listeners to be able to go to your website. It's a great informative website, and just what do you want us to know about Communicabo?
So, Comunicabo is well, I think we went over this a little bit earlier, but it's a foundation that is based here in Cabo. We only see kids with cleft lip and palate, and we help these families since the time these kids are born. Ideally, we'll get them when they're born, but that's not always the case. We've created, along with Los Cabos Children's Foundation, this great program with the state as well. So we have access to the different hospitals, the public hospitals here, in order to provide these surgeries for the kids. And we have follow ups and we have dentists. And we've created a great network here in Cabo where they see, the dentist sees the kids, the orthodontist sees the kids in a clinic that's actually my husband's clinic. So we donate the space there. And we've worked, great with other foundations, like I mentioned earlier, Inspire Mexico, also to provide the different offices. But it's a great program. I think it's a very unique program. We don't see a lot of programs like this in Mexico. That we only deal with cleft lip and palate kids, so our therapists are pretty much very specialized in this.
Mhm.
They're great at what they do. And yeah, I mean, I don't know what else to say about it, but it's an amazing program that's touched a lot of people's lives.
Yeah, and it sounds like it's a very much it's vital to that community. It's vital
Yeah.
to Mexico and Cabo San Lucas and La Paz,
Yes. Yes.
that those kids are you just serving kids in Mexico, or do you ever have kids from other areas come
No, it's only in Mexico. So really only in the Baja. We did a trial program with some kiddos from Mexico City
Mhm.
um, to do like this virtual therapy. There were some things that weren't, I don't know, it's a little difficult to do virtual therapy,
Right.
especially, with the population that we do see. Internet connections not always great. So it made it a little bit difficult. We're still seeing those kiddos, but we'll see what happens.
Okay. I love that. Regina, it has been so amazing having you on the show and just learning about talking about cleft lip and cleft palate, a very specialized area of speech pathology, but also just opening everyone's eyes to the fact that we are very lucky in the United States to
Yes.
have not only have the certified speech language pathologist and the programs that we have here to train us, but just access to services in general. If
Right.
you've got a child with cleft lip or cleft palate, or if you've got a child born with heart or physical needs,
Right.
Down syndrome, whatever it may be, the autism support. Um,
Right.
we're very lucky in the United States to have access to all of that. Um,
Yes.
and I thought it was important that we talk about that because I think that I know for me, I just assumed that because we go through the training we go through, everybody does that, and that's not the case.
Right. Yeah.
So,
And I think you see it more in big cities where you have more trained speech therapists, but
mhm,
not in more rural areas at all. And in the States, you do. You see, you see speech therapists everywhere. I mean, not everywhere, but there
yeah,
is access to speech therapy.
yeah, you're
Yeah,
right.
and I wanted to mention also, I mean, for anybody out there that has a child with cleft lip or palate, we work very closely with Dr. Catherine
Mhm,
Crowley from Teachers College in Columbia University in New York.
mhm.
And she has an amazing, amazing program. She has an amazing website. It's leadersproject.org. There are tons of materials on there. There's tons of videos. You can take her course. So we're all certified from her course. And it's super very well made, very easy to understand, and you get a lot of information on cleft lip and palate and how to work with these kiddos. Tons of strategies. You can download a bunch of games,
That's
and they're
awesome.
in yeah. And she's done an amazing, amazing job, and they're in tons and tons of languages. So
Oh,
whatever
wow.
language yeah. Obviously, we use all the Spanish material, but she has tons of different languages,
That's
and it's
awesome.
and it's really amazing.
Regina, make sure you get that information over to Katie because I do want to link the Community Cabo website, the Los
Okay.
Cabos Children's Foundation, and then that website as well for
Okay.
just for speech pathologists to go to
Yes.
and get those
Yes.
resources because, again, it is
Yes.
a very cleft lip and cleft palate. It's not traditional articulation therapy. It's a
No, it's
very
not.
specialized area, and the more we know, the better and the easier that we can help these kids. So,
Yep.
and, these kids
Sure.
are probably likely in the United States receiving medical speech therapy services at a hospital or a private clinic, but then they're also probably getting those services in the school system as well. So
Right.
they're getting a lot more intervention. So,
For sure. Yep.
all right. Well, thank you so much for joining
Thank you,
us. It has
guys.
been amazing. When I come back to Cabo in June or July, I will
Definitely need to meet up.
yes, we'll go
Yeah,
have
I spoke
dinner.
to the board about you, and I'm sure, we would all love to do something together.
Yes, that would be amazing. All right. Thank you guys for being with us today. We hope you enjoyed the podcast and we will talk to y'all soon. Thank you for tuning in to SLP Full Disclosure. You can learn more about this episode and our show on our website at amnhealthcare.com. If you enjoyed this episode, share it with a friend and subscribe to our show on your favorite podcast platform. You can also find show updates and SLP opportunities on our Instagram at AMN Allied. Special thanks to AMN Healthcare for making this show possible. See y'all next time.